Hi, everybody. It's Patricia Coughlin. I just want to make sure that you're aware of the webinar coming up on February 26th of this year, 2021. This is a webinar in which you're going to actually be able to see me put all the things I'm talking about on this channel into practice in two different cases. And in both cases, there are patients with symptomatic disturbances and certainly core conflicts around anger and sexuality. But in both cases, they also have significant character pathology, which has to be addressed before you can really, in a therapeutic way, get to feelings and an unlocking of the unconscious. So you're going to see me institute the central dynamic sequence in a trial therapy with these two different patients. So you're going to see the dynamic inquiry, in which, first of all, we're getting agreement about the nature of the problem, the goals, and the tasks. But also, as we really focus in, we're going to be able to start identifying and then intensifying the core conflict, acquainting the patient with their defenses, both specific defenses against specific feelings and those character defenses that create that kind of armor, right, preventing really therapeutic contact. So you're going to see how I work with these syntonic character defenses to turn the patient on them so they're actually willing, they're on board with the task of actually facing the feelings they've been avoiding. And then the actual visceral experience of those feelings, creating this unlocking of the unconscious with a download of memories and associations and dreams that make, in a sense, the source of the conflict very clear. So in a sense, the past is alive and becomes present where it can actually be reworked. And as Malin said, what has gone wrong has a chance to go right. And there's recent research by Alan Abbas on how important this initial trial therapy is to the entire process of the treatment and to outcome, right? Compared to a traditional psychiatric intake, this trial therapy, in fact, is so effective that in 1/3 of the cases, it's all that's necessary. The person actually doesn't need any further treatment. And also, what happens in that trial therapy is of great importance. So being able to actually facilitate this process of an emotional breakthrough is highly associated with outcome. So in order to accomplish this, you need to give yourself time. And I typically allow 3 hours for this initial trial therapy. And that gives you the time to get through that central dynamic sequence and to actually facilitate a deeply therapeutic experience in that first contact, which actually catapults the whole treatment forward. I see sometimes people who are, trying to learn ISTDP, but shoving it into a traditional format. So they're only seeing the patient for an hour or maybe 90 minutes for that initial, and they never get to the breakthrough. And they get sort of stuck in just doing defense work week after week. So I would really urge you, first of all, to come to the webinar and to see how I institute the central dynamic sequence with two different cases in that trial therapy so that you can really start to incorporate these factors into your own work. So I hope to see you on Friday, February 26th, and I'm going to leave a link to the event right below this video so you can sign up. Thanks. Hope to see you there. Bye-bye.